Well, thank you, Alan, Helen, Joya, Pisola, Gregory, for those really phenomenal comments and discussions. If you joined a little later today, I want to reintroduce myself. My name is Louise Ivers. I'm the faculty director for the Harvard Global Health Institute, and I just want to make a few closing comments and then welcome everyone who's here with us in Cambridge to join us for a reception to talk more and to chat and process everything we've heard today. But I'll start with a few thank yous, because I'm coming to the podium really filled with gratitude. You know, you can plan a symposium, you can think about bringing people together across disciplines, you can try to have it be in person and hybrid, and then you can see it manifest. And I have to thank all of you participating here in person. It's phenomenal to be closing out the day with a full house here in person and a full virtual audience. It's really been just fantastic. So thank you so much for being here and joining us. I want to thank the Faculty Club staff for hosting us and having such a lovely day. I want to thank the AV team for helping make such a lovely hybrid event that went so seamlessly. And I want to thank the HDHI team who've worked tirelessly for the last few months to put this together. And then I really just want to thank so much the participants, the speakers, the moderators. You know, you all were really chosen through a very deliberate process that we thought about what we wanted to talk about today. Nothing was by chance. There weren't any accidental conversations. We really wanted to have this rich conversation, and wow, you really brought it. Everybody thought very deeply about the topic. Everybody engaged in the topic in a really meaningful and profound way. And I personally just had so many profound moments during the day, and I'm not going to try to summarize them. I think that would be just too hard to do. But I did feel that through all the discussions, there's this really thoughtful sense that to advance health equity, to advance global health equity or local health equity, to achieve health for all, we can't disconnect the different pieces of it. This work is very interconnected. You know, we have to think about planetary health, justice, human rights, decoloniality, community-led work as frameworks to advance health. And if we're not thinking about those frameworks and how they work together with a holistic approach, we're probably not going to make the kind of progress that we're all thinking about. And we have to think about those things: justice, decoloniality, planetary health, human rights, not in a performative way, but we really have to think about them as actual mechanisms for us to have impact. And everyone today spoke about action and action for impact. And so I think that action-oriented and respectful partnerships are really an important lesson from the conversations we've had today, grounded in the notion that we must learn from history and we must learn from each other. And we have to radically change business as usual and make it business unusual, which is what Dr. Ogwell called on us to do. I think it's important to not shy away from the conversations we've had today. And I'm hopeful that the Harvard Global Health Institute, as we move forward in the months and years to come, can be an important part of a brave and courageous set of actions to step forward into achieving health for all. And I'm so glad that everyone was here today, and thank you very much. Please join us in the reception area.